The cytotoxic action of doxorubicin results from its binding to DNA of malignant cells and its inhibition of nucleic acid synthesis. It is incorporated between two base pairs in the double helix of DNA, thereby disrupting the normal configuration and replication of DNA-dependent RNA synthesis and protein synthesis. Doxorubicin remains one of the best anti-neoplastic therapeutic options that exhibits the widest spectrum of activity in human cancers. But as doxorubicin has a short half-life, it has to be administered at relatively high doses, leading to a subsequent risk of cardiotoxicity due to cumulative dose administered. To overcome this, efforts were taken on designing an improvised drug delivery system to lengthen the plasma half-life of doxorubicin so that it gets sufficient time to reach the tumor target. Moreover, a novel delivery system was necessary to mask conventional liposomes from getting engulfed and destroyed by the macrophages. This clinical solution was achieved in the surprisingly long life of blood cells in the bloodstream, which is related to the presence of a superficial envelope of dense hydrocarbon compounds. Numerous chemical compounds were tested to reproduce this protective envelope, and methoxypolyethylene glycol, that is MPEG, was conferred as the best option. When MPEG is grafted onto the bilayer lipids of the liposomes, it produces a protective effect by providing a long circulating half-life to the liposomes. These liposomes, also called as pegylated liposomes, offer a novel delivery system to protect doxorubicin from detection by the immune system, increasing its blood circulation time and thus enhancing its efficacy than the conventional doxorubicin. Sun Oncology introduces Lipodox, a new pegylated form of doxorubicin, comprising of an inner hydrophilic compartment containing 10,000 to 15,000 doxorubicin molecules, encapsulated in a bilayer sphere of lipids composed of cholesterol, the liposome. This vesicle is then surrounded by a dense layer of MPEG envelope. The entire liposome measures about 100 nanometer and is 100 times smaller than a red blood cell. Lipodox is not only a new addition to the armamentarium in the treatment of cancerous cells, but also a pharmacological breakthrough offering interesting pharmacokinetic properties. As when Lipodox is administered in an intravenous perfusion, the doxorubicin remains intact inside its protective liposome capsule, thus making it possible to get safely transported in the bloodstream without inducing an immune reaction from the phagocytes. These stealth liposomes can even pass through liver without activating the hepatic macrophages. Furthermore, the pegylated liposomes do not get eliminated and allow continuous transport of the active doxorubicin in their inner compartment. Thus, these pegylated liposomes are remarkably stable and long-circulating drug carriers, useful for delivering doxorubicin to the sites of solid tumors. Scientific studies suggest that within the pegylated liposomes, 90 to 95% of the encapsulated doxorubicin remains active, while the liposome circulates in the bloodstream. Moreover, the plasma clearance of Lipodox is slower than the conventional liposomal doxorubicin or free doxorubicin. These doxorubicin-containing pegylated liposomes not only inhibit destruction by the immune system, but also facilitate continuous circulation for 2 to 3 weeks after injection flowing through the tumor vessels several times. Some of these pegylated liposomes flowing through the tumor get filtered through the openings in the endothelial cells lining the newer formed tumor microvessels. After extravasation, the liposomes enter the interstitial space of the tumor tissue, where the local environment, the low pH, presence of free radicals, and lipases causes the liposomes to break open. Thus, doxorubicin gets delivered into the tumor cell, where it forms a complex by binding to the DNA double helix in the cell nucleus, eventually leading to cell death. This novel formulation of Lipodox is a promising and an exciting pharmacological innovation which ensures the direct delivery of a well-known chemotherapeutic agent of doxorubicin to the target tumor cells.